Yay.
But STDs are a thing. If you're not using protection, if you are even, sometimes it can happen.
They're huge.
They're a real thing for real human beings. It doesn't just happen if you are sleeping around with 10 people. It can happen if you are having you have a boyfriend and you sleep with someone one time.
Yep.
So,
and oral sex too. Yes, anything on the mouth, it can create an oral herpes lesion that is not as concerning as a genital herpes lesion, but that can be on women's labia or on men's penises, and they can have ulcers. So, even if it's not penetrative sex, yes.
It can still happen. You can still get it.
Ages. I am seeing right now peak issues in women who are over 40 because one, they think that they're not going to get pregnant. Two, many are not in relationships that are long-term. Three, they don't think they have to protect because it's a 20, 30-year-old issue. It's not.
Mm-hmm. It doesn't just happen when you're in your college years.
Right.
What STDs should we normalize the conversation about, or what STDs do you see often that people should know the signs of and be able to talk about?
Yeah.
Right.
And that's why we definitely need to talk about this, is because straight candid, this is taboo and no one's going to talk about it. No one admits to having any types of STD, even if it's
your best friend,
even if it's 80% women that have a certain, no one admits to it. No one's going to talk about it. So
even
that's
conversations about with your best friends, closest friends, are not going to reveal that. Yeah. Hardly ever.
It's intimate. Yes. And people are afraid because we've not normalized the conversation, right?
Mm-hmm. So,
well, the most common STDs are still eons the most common. I've been in practice now 19 years and 4 years on top of that. So 23 years with my training, but it's still the most common: gonorrhea, chlamydia, trichomonas. So those three are the trifecta. Trichomonas. You don't hear it very much, but it is oftentimes associated when someone has gonorrhea or chlamydia or both. They can have all three. So gonorrhea and chlamydia are treatable, but if they go untreated and a woman doesn't recognize it, or a man, but a woman especially, it can create some havoc inside the belly. It can create some scarring, adhesions, pus. It can create tubal occlusion and scarring. It can create infertility.
For gonorrhea and chlamydia, isn't there symptoms for that, or not?
The biggest
always?
symptom is really, really prominent discharge, and it's usually very yellow. It can be green. There can be an odor. It can be hot, uncomfortable. Those are the signs and symptoms for any vaginal infection. For men, they'll have clearly obvious, and I don't need to be a specialist in men's health to see this because they've seen it, but they'll have very classic yellow penile discharge, and it'll just emanate off the penile head just out of nowhere.
Oh,
so
yum.
Yeah.
Wow.
Yummy.
Right. So gonorrhea, chlamydia, trichomonas, they're treated by antibiotics. If you recognize it, you come to your provider, you get tested. The tests are really easy. They can be off the urine sample. For men, to be most accurate, it's actually a swab in the penile opening. But but really we want to get, a urine sample or a vaginal swab or a penile swab.
With somebody who doesn't feel quite comfortable, maybe going to their provider, these guys are cringing over here. Their toes.
And I always look at them when I'm talking about the guy things too. I feel like,
are you guys Googling what it looks like?
Okay, thank God.
Okay,
I'm what is this guy doing?
Let us know
over
when
here?
you want to hop on and ask any questions.
Yes. Right.
With somebody, suggestion for anybody who is not quite comfortable going to their provider and they're seeing these issues, just freaking go. Should they go online? Just go. Okay.
Just go, because the tests we're doing are very accurate, and it's important to be seen.
But some people, they avoid the doctor at all costs, right? But these are this could cause infertility. You need to go in.